I don't know what you found, but I find when I'm examining them, they're not low-level exercise. They're high-level exercise. And like, you've got the prostate of a 20-year-old. This is all just, I'm just
I
telling you.
can check all your prostates now, and we can correlate that with your level of exercise.
Wow.
How many guys do we have in this room? Get me a box of gloves.
Prostate check and correlate with the exercise.
I've never done it. I'm not doing
you
it.
need a rim job?
Yeah.
We're not doing that. This is not that kind of movie.
No, he's a trained expert.
It's after hours by now.
So I have a question. If you catch symptoms of BPH early, is it possible to reduce the chances that you have to get the the level 5, 6 surgeries and stuff like that later on? Is it beneficial?
Finasteride and Avodart dutasteride actually studies shown that reduce the risk of complications and need for surgery from an enlarged prostate by about 50% if taken over a long period of time. So
And can that prevent prostate cancer and all that? If you treat everything early, if you catch everything early on?
Yeah, so that's a huge can of worms you just opened, because it's an extremely controversial subject. There was studies done to study that, the effect of Proscar and Avodart on prostate cancer prevention. So and you have huge fights over the results of these studies. So it's inconclusive. There's some studies which show that it does decrease the risk of number of cases, and then there was a suggestion that maybe it decreases the number of prostate cancer cases, but the ones getting it were more aggressive.
Wow.
So that's never really been answered, the final answer. So
Is there a natural way then?
a natural way to reduce prostate cancer?
And then about to reduce
The risk of
growth
prostate
cancer and keep it healthy.
I mean, I think that's a great question. I don't think there's a lot of science behind that. But what we tell our patients, because there's some small diet studies which they're hard. So it was a big study, but they were studying diet. And the only thing that came out was tomato sauce.
Because of the lycopene.
Lycopene, 10 tablespoons a week reduced your risk of prostate cancer about 35%. Now, it's hard to do those kind of studies, but without anything else, I think it's a great question. Why not? If you like tomatoes, have some.
And it's interesting because as opposed to many dietary things, it's processed tomatoes which brings out the lycopene.
Yeah.
So tomato sauce
Yes.
is better than eating full tomatoes in terms of lycopene. Yeah.
So tomato paste, tomato
tomato
sauce,
paste is,
all of these things.
they
And
bring
out the lycopene.
Yeah.
Yeah.
So that's why the Mediterranean diet, the Italians, they have less.
Prostate cancer.
Yeah, like in Italy, I mean.
Maybe it's the sauce. Yeah, maybe.
Wow.
And to Nick's point also, again, this hasn't been studied and there's no big data or research on it, but just from personal experience over my career, I found interestingly, the patients that exercise a lot, not a little, they have small prostates. I'm not talking about prostate cancer, but their prostate, I don't know what you found, but I find when I'm examining them, they're not low-level exercise. They're high-level exercise. And like, you've got the prostate of a 20-year-old. This is all just, I'm just
I
telling you.
can check all your prostates now, and we can correlate that with your level of exercise.
Wow.
Do we have
So
gloves?
is this cardio
Wow.
or muscular?
What an incredible study.
What is it?
How many guys do we have in this room? Get me a box of gloves.
Prostate check and correlate with the exercise.
I've never done it. I'm not doing
you
it.
need a rim job?
Yeah.
We're not doing that. This is not that kind of movie.
No, he's a trained expert.
It's after hours by now.
So wait, so when they studied this, or when this has come out, that
Yes.
because this is a big point now.
Yes.
People who exercise a lot, athletic level exercise.
Yes.
Right.
Yes.
Well, I don't know if this has been studied.
No,
This is
it
your
hasn't.
It's your personal
This
observation.
is personal observation, and we're thinking we should do this.
Well,
study.
listen, I think this is interesting.
Yeah.
So athletic level, is this like athletic level, like cardio and weights, or is it like someone who's done for a civilian a good amount of
I
exercise?
can't tell you. I think if you ask me off the top of my head from my personal patients, so not scientific, I would say they were doing a lot of aerobic exercise.
Aerobic
Yeah,
exercise.
they tended to be more aerobic.
Wow.
But there was a mix of both. We know for cardiovascular, that we've defined. We know you need 150 minutes. You need a mix.
Aerobic.
Of total exercise. More aerobic than weight training, but you certainly need the strength and the aerobic together.
See,
that's clear.
That's controversial because go ahead.
Actually, in terms of exercise, what I tell patients, because I get that question every day, What can I do to, reduce my risk of prostate cancer? I say, look, you and me and him are much more likely to die of heart disease. So stop worrying about what you can do to decrease your risk of prostate cancer and do exercise and live a healthier life, because you're more likely to die from your heart than your prostate.
Still the number one killer
Yep.
in North America, heart attack and stroke, men and women.
Wow.
Yeah.
So, and the contributing factors to that is obviously smoking is number one.
Yes.
Probably.
Yes.
Diet.
Diet.
Yeah. And
Yeah.
just and being sedentary.
Right.
Right.
So
Stress has to be.
And all the diseases that go with those factors, diabetes, high blood pressure, cholesterol.
huge. So these 7 risk factors, right? So we talk about high blood pressure, we talk about smoking,
Right.
cholesterol level, we talk about diabetes, we talk about stress. There is a small genetic component, and we talk about weight.
Marriage.
Uh,
To go back to our previous point.
Monogamy. Monogamy. Monogamy is a killer.
Yeah.
and,
The
the,
silent killer.
and the crazy thing is,
It's the number one
that-
condition.
and the crazy thing is, we used to have smoking at the top of the list, but I think stress is now pushing out smoking. It's a close number 1 or number 2, so it's an incredible impact on the heart.
Yeah. That's why I think, stress, to alleviate stress, exercise definitely helps.
Yeah,
That brings your stress level down.
Yeah.
Comedy shows.
yep,
That's right.
SugarSammy.com for tickets.
number 1.
Number one.
Yep, stress reduction.
So now I have a question.
Well, there is laughter therapy. and
Yeah.
laughter,
Yeah, it's true.
But
It's
laughter therapy, I've seen like those crazies who do laughter yoga. That's
yeah.
just nuts.
Okay.
Like I feel like if you really want to laugh, go to a good comedy
But it's
show.
got to
Yes.
be a good comedy show.
Yeah,
Yes.
you know those people who force like they cut together and it's like hysteria of
They
laughter.
push their-
It's kind of crazy.
weird.
Like you
Yes.
could just go watch a comedy show and get the same effect and not look like a nut job, right?
Right. Especially if it's a comedy show in France or Quebec.
Or Quebec,
Right?
and especially bilingual shows in
Yeah.
Quebec.
In the time of caveman, it was fight or flight, so he had to run away from a saber-toothed tiger. So the cortisol went up when he had to run away from the tiger, then it went down. We were built like that. Now in modern day living, it goes up,
Yeah.
it stays up 24 hours. That
Because you know what the
burns.
tiger is.
And we
the
know
tiger's the bank.
And we know exactly.
We know what it is. It's running away from your mortgage and your payments, and the bank doesn't close down, man. Even when they say they're closed, they come after.
24 hours?
Yeah, Revenue Canada, Revenue Quebec, that's the new tiger. You know what I mean? They don't stop chasing you when you owe them a little bit of taxes.
And when you're
Not for
sleeping.
personal experience. I'm saying this as a friend. I'm a friend, but